Hi, I'm Juliet. I'm a postpartum nurse, and I've spent a lot of time helping moms and babies breastfeed. The goal of this video is to help you get confident in your ability to breastfeed your baby. I'm going to talk about 5 common roadblocks that are encountered early in the breastfeeding process. Most of these are normal and can be easily addressed. Let's get started. Roadblock number 1 is feeling like you aren't making enough colostrum or milk for your baby. It is completely normal to have very small amounts of colostrum, perhaps only a few drops. This isn't something that you need to be concerned about. Milk works on supply and demand, so the more that comes out of your body, the more that your body makes. You should remove colostrum for your body regularly. Often, this will just be done by latching your baby. If this isn't possible, either because your baby doesn't want to latch or because you need to be separated from your baby, you can do this through manual expression. To do manual expression, make a C shape with your hand, place it on your breast, push backwards against the chest wall, and then move your hand forward. You're going to do this at several different angles. It may be tempting to just squeeze your nipple, but colostrum is being produced all over your breast, and using these large, broad motions will help move it forward. You can express it to a spoon and feed your baby with a spoon, or express into a syringe if need be. Roadblock number 2 is having a sleepy baby. It's very normal for babies to be really sleepy on the first day of life, but it's so important that we give them lots of opportunities to eat. If your baby is sleepy, try gently unwrapping them and stimulating them by checking their diaper. If they still aren't responding, do some of that manual expression that we just talked about and do a spoon feed, and then bring your baby skin to skin, which means bringing their naked body onto your naked chest. This may help them perk up and be ready to eat. And if so, great. If not, that's okay. You can know that they got some calories from that spoon feed they just did. When baby does latch, you'll probably notice that they take several sucks and then take a break to breathe. This is normal. It's called suckle bursts. However, if baby is not sucking again on their own, gently stimulate them by tickling their cheek or under their chin. If this still isn't working and they're still just asleep, try unlatching and bringing them to the other breast to offer the other side. And again, if that doesn't work, that's just fine. Just try again in a few hours. Having a sleepy baby doesn't mean that there's anything wrong with them. Roadblock number 3 is that it hurts. A good deep latch is essential for both your comfort and for ensuring good milk transfer. Often when breastfeeding it hurts, it's because the latch needs some work. So how do we get a good latch? Well, you're going to wait for your baby to have a nice big mouth. Think of baby as taking like a big bite of a hamburger or eating corn on the cob as opposed to drinking from a straw. As soon as they open wide, bring baby to the breast with the nipple pointed towards the top of their mouth. One easy thing to look for is dimpling in the cheeks. If they're doing that, it means they're not latched well, and you should unlatch and try again. Roadblock number 4 is feeling like your baby isn't positioned well or is slipping off of the breast easily. A newborn needs to be actively supported during breastfeeding in a position that makes it easy for them to latch and stay on the breast. There are several positions that can accomplish this. I'm going to show you 2. You need to have good control over your baby's head and also over your breast. This means one hand on each. You'll notice that if I'm holding baby in a typical cradle hold, their head is in the crease of my elbow, which does not give me good control. Instead, let's try the football hold. You'll want to be comfortably sitting upright with pillows behind your back and under your arm for support. Baby's body will be tucked to your side, with their back supported by your forearm and their head supported by your hand. With your free hand, you'll compress your breast tissue, creating an easy shape for baby to latch to. Like we just talked about, when baby opens wide, bring baby onto the breast. Continue to firmly support baby's head throughout the feed. They aren't strong enough to keep themselves on yet. Next, let's do the cross cradle hold. The neat thing about this is that it's just like football hold, except you're switching breasts. So instead of baby's body being tucked to your side, you'll bring baby around right in front of your body. Use pillows for support. The free hand now goes to your other breast. You see that these two positions are very similar, with just a little bit of movement to get baby to the other breast. One more note, in whatever position you choose, you should be able to relax and not feel strain in your arms, shoulders, back, or neck. Babies eat a lot and it should feel comfortable for both of you. Roadblock number 5 is baby suddenly wanting to eat all of the time. We've talked about how in the beginning, babies are really sleepy. However, around 24 hours old, they can do a complete 180 and want to eat very frequently. Having a baby who wants to eat all the time will often cause parents to worry that they aren't getting enough to eat at each feed because they're wanting to latch so often. However, this is called cluster feeding and is not only normal, but serves a very important purpose of helping to establish a good supply. When this occurs, it's critical that you have a good latch so that, like we talked about, your nipples are protected and baby is transferring milk effectively. Also, you'll want to offer both breasts at each feed. So if baby falls asleep on one side, gently stimulate them and offer them the other. This will get them as much to eat as possible during each feeding session, and hopefully will get everyone some rest in between feeds. Know that most people find breastfeeding challenging to some degree. So if this is true for you, good news, you're normal. But you don't have to do this alone. Your nurse and lactation consultant can give you specific individualized help and instruction. Best of luck, you got this.